Good afternoon, everybody, and thanks so much for joining us here on KXAN Live. I'm Will Dupree. In just a moment, we're going to be carrying a briefing from the Texas Department of State Health Services. It's going to be talking about how much COVID-19 vaccine we will be receiving in Texas next week. This will be the first update they're providing since that recommendation earlier this week that the federal government asked states to pause using the Johnson & Johnson vaccine after very rare cases of serious blood clots. We've reported extensively about that over on KXAN.com, but this will be the first chance that we find out what this state agency thinks will happen this next week as this pause remains in effect. Texas Department of State Health Services did ask providers to not give out the Johnson & Johnson vaccine if at all possible, as this review from the federal government is underway at this point. So we'll see again what the agency says here in just a moment. But we've seen in the last few weeks that our allotment of the number of COVID-19 vaccines that are arriving in Texas has only kept climbing. And if you just want to get a good indication about what happened last week with the apportionment we got, here's what we received. More than 1 million first doses, and those went out to 2,011 providers. Second dose allotment of 626,000, a little more than that. And then more than 900,000 first and second doses went to pharmacies, federal health centers, and dialysis centers identified by the federal government that could administer the vaccine. The briefing is about to begin now with Texas Department of State Health Services. Let's take a listen.
Associate Commissioner for Laboratory and Infectious Disease Services. She is also the chair of the Texas Expert Vaccine Allocation Panel. Today also we have a new guest for us, Jennifer Schufer. Dr. Jennifer Schufer, Chief State Epidemiologist, will provide an update on the situation with the Johnson & Johnson vaccine. As a reminder, to ask a question on vaccination, please type it into the question box. You'll see that on the sort of in the panel on the right side of your screen. Also, when you're typing your question, please include your outlet so that we can recognize that it doesn't automatically show that. We will get your name, but not the outlet you work for. And we will, of course, as usual, get through as many questions as we can in the time we have today. The briefing is being recorded, and we'll send a link once it's posted and available to you. And with that, I'll turn it over to Commissioner Garcia for some opening remarks.
Thank you, Chris. Good afternoon, everyone. It's good to be with you today, and thanks for spending your afternoon with us. It's been an interesting week in the world of COVID-19 vaccine, and the good news is that vaccination has continued at a brisk pace. Texas has now administered more than 5.2 million doses. That's just about 2 million more than where we were this time last week. Now, overall, this represents 9.7 million people who've gotten at least one dose, more than 43% of eligible Texans. Now, more than 60 million people have fully vaccinated and over a quarter of eligible Texans. One thing that we don't mention very often, the doses that we talk about are those that are reported to us within our immunization registry, known as MTRAC. There are actually more doses administered to Texas because the federal agencies that are doing vaccination don't generally report their doses into our immunization registry. For example, the Department of Defense vaccinating active duty military, the VA vaccinating veterans, and with the state having such a large military presence and so many military retirees, that is a significant number. However, those doses are reported to the CDC, so their data shows a larger number of doses administered and a higher percentage of the population vaccinated. That's just for the federal department. Private organizations getting vaccine allocations from our federal partners, like pharmacies, do report into MTRAC, so those doses are counted in our data. Now, I do want to say a few words about the Johnson & Johnson vaccine and asking all Texas providers to temporarily pause administering it. As you've heard, that's because of 6 rare cases of a blood clot in combination with a low platelet count. Dr. Shuford will share more information from the scientific and medical perspective, but I do want to emphasize that from where we are at this point, it appears to be an extremely rare event. This shows that the vaccine safety system is working. These rare events were reported and recognized as a possible issue that needed to be evaluated so that people can have confidence in the COVID-19 vaccine. Given the timing, we're already planning on getting a lot less J&J vaccine this week and planning on getting even less next week. The vast majority of what we've been getting has been Pfizer and Moderna. So if the pause is fairly short, it shouldn't have a major effect on the availability of vaccines for Texans. Even without the Johnson & Johnson vaccine for now, we're allocating more than 700,000 first doses of Pfizer and Moderna to providers all across the state next week. Now, this doesn't include the doses going to the federal retail pharmacy and other federal programs, and it doesn't include second doses. So there will still be well over 1 million doses coming into our state. That means if you've been hanging back and waiting for vaccine availability to increase, now is the time to look at where you can get vaccinated close to you. More small providers like pharmacies and doctors' offices have received vaccines over the last few weeks. So if you don't want to go to a mass vaccination site or get on a long waiting list, there are more options for you. And while we've made great progress, we know that there are still more people to be vaccinated, and we want those people to get vaccinated as quickly as possible, even if we know that vaccine is becoming easier and easier to get. So now I'd like to introduce Dr. Jennifer Schubert, our Chief State Epidemiologist, to provide a little more information about the Johnson & Johnson vaccine and what we've seen with it.
Hi, y'all. So on April 13th, the CDC and FDA made a joint statement recommending that there be a pause in administering the Johnson & Johnson COVID-19 vaccine. And at that time, there had been 6 cases reported to the Vaccine Adverse Event Reporting System, or VAERS, of people experiencing severe blood clot events after getting the Johnson & Johnson vaccine. And in these cases, a type of blood clot called cerebral venous sinus thrombosis was seen in combination with low levels of blood platelets, also known as thrombocytopenia. And this is an unusual combination. All 6 of these cases occurred among women, aged 18 to 48, and symptoms occurred about 6 to 13 days after vaccination. So CDC and FDA recommended pausing the use of the Johnson & Johnson vaccine in the United States, and this was for a few reasons. They wanted to have the chance to review the cases that had already been reported to evaluate the possible link between the vaccine and this type of blood clotting event. They wanted to give time for healthcare providers and other individuals across the United States to report additional cases of this rare blood clotting event occurring after receiving the Johnson & Johnson vaccine. And finally, they wanted to have the chance to educate healthcare providers about this potential complication. The blood clotting events that are being reported with this vaccine are rare and are treated differently than many other types of blood clots. So there's some education that needs to happen for healthcare providers about how to diagnose and treat these rare blood clotting events that may be associated with the Johnson & Johnson vaccine. Now, an advisory panel for the CDC met yesterday and decided that they need more data before making a recommendation. They plan to schedule another meeting in the coming days to weeks to reevaluate this pause. They'll be considering whether to recommend the use of this vaccine for the United States public and whether it should be recommended maybe only for specific groups, like a certain sex or age group. The really good news is that this type of blood clotting event has not been reported with the Moderna or Pfizer vaccines, which are a totally different type of vaccine. These vaccines still represent a really good option for preventing COVID-19 and for taking all of us a step closer to ending this pandemic. I think a lot of people right now are wondering what they should do if they got the Johnson & Johnson vaccine. And we recommend that anyone who got this vaccine monitor themselves and watch for symptoms that may occur. Now, it's important to remember that mild side effects from COVID-19 vaccines are common. They're a sign that the immune system is responding to the vaccine. And so I'm talking about things like pain at your injection site, tiredness, headache, or fatigue. Now, these side effects usually start within a day or 2 of getting the vaccine, and they usually go away within a few days. But the symptoms of this rare blood clotting event, that are important to watch for include things like a severe headache, abdominal pain, leg pain, or shortness of breath that occur within 3 weeks of getting the Johnson & Johnson vaccination. Now, if you had the Johnson & Johnson vaccine within the last 3 weeks and you develop these symptoms, then please contact your healthcare provider for information about what you should do next. We're also asking clinicians to do a few things. We're recommending that clinicians do not administer the Johnson & Johnson COVID-19 vaccine to their patients until CDC's Advisory Committee for Immunization Practices is able to further review these reported cases of cerebral venous sinus thrombosis and thrombocytopenia and assess their potential significance. We're also asking clinicians to be on the lookout for symptoms that could represent serious thrombotic events or thrombocytopenia in their patients who have recently received the Johnson & Johnson COVID-19 vaccine. It will be important to check platelet counts in these patients and to screen for evidence of immune thrombotic thrombocytopenia. For patients who do have a thrombotic event and thrombocytopenia after the Johnson & Johnson COVID-19 vaccine, they should not be treated with heparin unless HIT testing, HIT is heparin-induced thrombocytopenia, unless HIT testing is negative. And please report adverse events to VAERS, that vaccine adverse event reporting system. That includes these types of clotting events as well as other serious adverse events and deaths in patients following receipt of COVID-19 vaccines. That is a very important part of the vaccination process so that regulators and public health professionals can be alerted to any possible issues and take appropriate action to ensure vaccine safety. And that's something that anyone can do. You don't have to be a healthcare provider to report an adverse event to VAERS. You can be a member of the public or the person that got the vaccine. Anyone can report at vaers.hhs.gov, vaers.hhs.gov. And that's all I have to share for today.
Thanks, Dr. Schufer. Appreciate it. And thank you to Commissioner Garcia. With that, we can move to your questions. As a reminder, you can type those into the question box. That's part of that drop-down menu on your right there. We have a few queued up already, starting with kind of a couple that go together. Imelda, I ask these to you. Gina Sinceri with ABC News says Chambers County put out a press release yesterday saying they had more vaccine than they could use because of vaccine hesitancy. Are you hearing this from other counties about this issue as well? And Aparna Zalani at Channel 11 in Dallas says we've seen in North Texas the line that some hubs have significantly declined. Are you hearing that from other areas? And if so, do you know why they're getting shorter? Are you concerned about vaccine hesitancy, especially after the Johnson & Johnson news?
Thank you, Chris, and thank you for those questions. So I don't know if the excess vaccine in Chambers County is due to vaccine hesitancy. What I do know is that week after week after week, so for the past 3 weeks, we continue to see increased doses administered being reported to our immunization registry. So that really signals that the demand out there is still great. Now, they may be seeking it in different locations, so they may not be going to the bigger hubs in order to be vaccinated. But as we have been working to expand the access points, people have more choices to get vaccinated now. And so that may result in some of the hubs having lower demand, even though our doses administered continue to go up.
Kind of another sort of related question about hubs as well from Jessica Shorten at the Montgomery County Gazette. With the increase in vaccinations and expansion of eligibility, is DSHS considering phasing out vaccine hubs? And if so, when would that happen?
So within our expert vaccine allocation panel, we have ongoing conversations about whether it's the right time to change strategies. Now at this point, because we know that the younger population that we just opened eligibility to is still really big, we don't want to fully pivot away from our hubs. We do know that some of them have reported, less demand. So we are making adjustments on allocations based on their requests and based on what they're seeing. And in line with what our locals officials are signaling on the ground.
Question for Dr. Shuford from Valerie Gonzalez at the Monitor. You mentioned that the clotting is not, we haven't seen this issue with the Pfizer or Moderna vaccines because they're different types from the Johnson & Johnson vaccine. Can you expand a little bit on what the differences are between those vaccines and how that may have contributed to this difference?
Sure. So the Moderna and the Pfizer COVID-19 vaccines are something called mRNA vaccines. And the Johnson & Johnson COVID-19 vaccine is a viral vector vaccine. And so it uses a virus, an adenovirus, that has just a small piece of that SARS-CoV-2 virus, or the virus that causes COVID-19 inside of it. And so that's what's in the Johnson & Johnson vaccine. And it's similar to the vaccine technology that's used for the AstraZeneca vaccine that we've been hearing about in Europe. That one is also a viral vector vaccine that uses an adenovirus vector. And so the type of technology used for these vaccines are different. I think that we're still trying to figure out exactly how the vaccine platform is associated with these complications, if it is and how it is. There's a little more evidence coming from Europe based on the AstraZeneca vaccine, but we're still trying to work that out here in the United States with our Johnson & Johnson vaccine and seeing if the patterns that we're seeing here are similar to those that they're seeing in Europe and what that means for these viral vector vaccines. There's still just a lot of research that has to go on, but that's why reporting these cases is so important. We need all of the information that we can possibly gather on this rare side effect to see how it's related to the vaccine and to figure out who it may be safer for.
Next question from William Joy, WFAA in Dallas. With Texas hospitalizations ticking up and counties out of wait list names in some parts of the state, how concerned are you that the state could see increased spread? Dr. Schubert, let me let you take the first crack at that, and maybe you can address kind of just generally what we're seeing and how vaccination plays into that.
First of all, we're seeing fantastic vaccine uptake, and the public health and volunteers, healthcare professionals across the state are doing a wonderful job of vaccinating our population. We have seen significant drops in the number of COVID-19 cases here in Texas, COVID-19 hospitalizations and fatalities. We are starting to see that cases in some parts of the state have flattened out or even show small rises. And this is concerning to us. We're watching very closely to see if hospitalizations follow those trends that we're seeing in the cases. One of the reasons why this is concerning is because we know that there are these mutated forms of the virus called variants that are increasing in prevalence here in Texas as well as throughout the rest of the country. We know that these variants can be more transmissible, so they can infect more people, and that in some cases they might have greater severity of illness, so they might cause more people to end up in the hospital or dying from COVID-19. And so we'll be watching those variants very closely and watching our cases, hospitalizations, and fatalities. But what's important for right now is that everybody go out and get the vaccines that are available, because this can decrease your chance of getting infected and the chances of new mutations emerging.
Thank you, Dr. Schubert. Next one from Jordan Rubio with the Houston Chronicle. Imelda, this is coming back your way. With the allocation panel planning on sending more doses to smaller providers going away from the hubs, are there any concerns about data quality from those smaller providers? Have those providers had any problems with submitting data to the state effectively in the past?
So we're doing a couple of things to proactively reach out to new providers as we make those allocations to them. So as we add folks that have not received vaccines so far, and this is going to be their first time potentially reporting COVID-19 vaccine, our outreach team does reach out to them, make sure that they know that it's coming, make sure that they are prepared for it, that they know what the reporting turnaround time is, and that have an opportunity to ask questions so that we can streamline any issues that they may have. Now, we are watching the data very, very closely, not only for our well-established providers, but also for those new ones that we have allocated vaccine to recently. And where we notice that they may not have been moving through the vaccine as quickly as we would expect, we reach out to them. We have conversations about, how many doses do they have on hand? Are they having any reporting challenges? And if they do indicate that they have reporting challenges, that's where we are proactively engaging with them to either work through the data exchange issues, if it's data quality, In cases where they may need help with data entry, we are offering support from the Texas military to help get the data into MTRAC as well. So we're trying to be very proactive, and then in instances where they may be struggling, we are providing additional support as well.
Question from Lori Brown at Fox 4 in Dallas. Is there a decline in demand for the Pfizer and Moderna vaccines due to the Johnson & Johnson concerns and people worrying about the still new nature of these vaccines overall? If so, how do you reassure people to get the vaccines?
So we haven't seen that thus far. What we saw when J&J was first announced is very much an eagerness for the J&J vaccine because of its simplicity, not only on the administration side, but just from a personal side, you don't have to come back for the second dose. But by far, we still have good demand that's being demonstrated by our week after week increases in doses administered.
Sorry, just scrolling down here. Jessica Shorten with the Montgomery County Gazette is following up on her question. Blood clotting has been a rare side effect of both the Janssen and AstraZeneca vaccines, as you mentioned, Dr. Shuford. Is this due to a particular similarity between those two?
That is the concern. There is still research going on to figure out what the underlying mechanism is that could be linking these vaccines with these blood clotting events. And blood clots happen in our population all the time for a lot of reasons, and blood clots have been noted to occur in study participants in different vaccine trials as well. What's different about the blood clots that are happening with the Johnson & Johnson vaccine and the AstraZeneca vaccine is that these are blood clots in places like the cerebral venous sinus thrombosis, as well as some blood clots happening in and around the gut, in the presence of low platelet counts. And that sort of combination of factors is very rare. And we're seeing that, though, that syndrome, that combination of blood clots with low platelets happening with the AstraZeneca vaccine and the Johnson & Johnson vaccine. And so, because these are rare events that are happening in recipients of these vaccines, there's a lot of investigation that's trying to figure out the mechanism. Right now, they think it's an immune-mediated mechanism, but like I said, there's a lot of research that's happening to look at both of those vaccines. But I can also tell you that the regulatory agencies, the one for the European Regulatory Agency as well as the FDA, are sharing data as well so that we make sure that we get safety data from around the world to better inform the decisions we make about vaccines.
Dr. Shuford, I'll pitch this one your way too. A question from Lori Brown again at Fox 4 in Dallas. What would you tell people who are hesitant to get the Pfizer or Moderna vaccine because they worry there could be side effects that have not yet been discovered?
So there is a very real concern about side effects from any medication or vaccines that we put in our bodies. It's good to be concerned. I can tell you that the Moderna and Pfizer vaccine have been deployed widely across the United States in over 100 million people. I think we're getting close to 200 million people now. And so we've had a good population getting that vaccine, and we are not seeing these types of safety signals happening with the Pfizer or Moderna vaccines. And so we can feel confident because we've had such a huge population get that vaccine and not seeing these sorts of severe safety problems. The other thing about the Moderna and the Pfizer vaccine is that they are highly effective. And so that combination of being safe and effective is really helps us make a strong recommendation for people going out and getting those two vaccines.
At this point, I mean, I think it's clear that what we're seeing from the disease is, the effects of COVID-19 itself are far surpass any effects that we're seeing from the vaccine.
That's true of the Pfizer and Moderna vaccine, and it's important to note, too, that COVID-19 itself can cause severe blood clotting and numerous other long-term health effects. And so we do think that getting these COVID-19 vaccines, especially the Moderna and Pfizer right now, can protect you against a lot of severe health complications that come from COVID-19 itself, and that is a worthwhile endeavor to protect yourself from getting COVID-19.
A couple of questions, again, that kind of go together. One from William Joy, WFAA in Dallas, and one from Ashley Lopez at KUT in Austin. William Joy asks, you said you're making adjustments to allocations based on what's requested by providers. Does that mean the state's moved away from going mostly by population with its allocations? And are there what regions are getting increased or decreased supply because of that? And from actually asked, have there been providers asking the state to start shipping fewer vaccines to them? Because some have had, there have been reports from around the state that some are having a harder time filling vaccination slots.
So yes, one of the things that our expert vaccine allocation panel has really focused on is flexibility from week to week in order to make sure that we can make adjustments in our distribution methodology. So as we have seen different providers tell us that they would like reduced allocations or no allocations for a couple of weeks, we are honoring those requests. Additionally, where providers, we have been pushing vaccine to them, and then they may not ask for some from across different communities. You'll notice that some counties may not receive as consistent allocations as they had once, and that's because we're not seeing the requests coming in from some of those providers. Now, strategically, we are still very much paying attention to allocation as a proportion of the total population, the total adult population. And then we're continuing to actively monitor the doses administered within those counties to see where we may need to push more vaccine. Now, just because we don't actually allocate vaccine to a county does not mean that they do not have access to it. So in the instances where we may not have additional providers asking for vaccine, those are the opportunities that we share with our Texas military partners. We inform our public health regions to make sure that they can go do targeted special events in those communities to make sure that vaccine is still available. So those are some of the shifts that you should see. And even though you may not see all of it in our weekly allocation roster, there are additional vaccine events and access points that are occurring in those communities.
We have time for just a few more questions. Shannon Najmabadi at the Texas Tribune asked if there's a chance the pause with the J&J vaccine will affect people waiting to get their second doses of the Pfizer or Moderna vaccines.
I don't think so. We definitely know that the providers have the capacity right now. We know that the second dose inventory is strong, and they have the capacity to be able to manage both first and second doses. So we want to encourage everyone that if it's time for your second shot, that you show up and go get it.
Absolutely. Dr. Schufert, a question for you from Betty Cross at CBS Austin. What's the timeline for getting a definitive ruling or a recommendation on the J&J vaccine? It was suggested the decision could come quickly. Do you think that'll happen, or are we looking at weeks here?
It's impossible to know. I can tell you that the ACIP, that Advisory Committee for Immunization Practices that's associated with CDC, that committee is planning to meet over the next week. They were hoping not to get their next meeting over a week out. So hopefully we'll have some further information from them then. However, several of the members of that advisory committee had wanted to wait a little bit longer to gather more data from people who had just recently been vaccinated. So I think there was a suggestion that maybe there wouldn't be a ruling for a couple more weeks, but we should have an update from them within the next week.
And the last question is for you, Dr. Schufert. Jessica Shorten at the Montgomery County Gazette asked, what variants are most prevalent in Texas at this time? Has there any particular variant become the dominant strain here?
Far and away, the most common variant here in Texas is the UK variant, B117. That's true of the entire United States right now. We do have many other variants that are circulating in communities here in Texas, but the UK variant is the most common, and we do think that it is that it makes up the majority of the infecting viruses at this point in time.
Thank you very much, Dr. Schufert. And just as a note, we'll have Dr. Schufert back and to talk a little bit more specifically about variants. So we're actually planning to do that this week until the Johnson & Johnson news came up. So look for that in the future. We'll dig into the variant situation a little bit more as we go forward and kind of what the implications are for that. One last thing. Well, I see one last thing from Wes Rappaport at Nexstar, who asks just confirming that no Texas clotting cases are known at this point. That's correct. Last I have heard, unless you all have heard anything. This point, nothing has yet been reported from Texas, so that is correct. That brings us to 2:30 and the end of our time that we have for today. I appreciate so much you being with us today. and sharing the information with your viewers and readers and listeners out there. Really appreciate the role you play in helping us get accurate and timely information out to the public, particularly on this, what continues to be a very important, topic of vaccination, encouraging people to follow through, get their first dose, get their second dose, and help us work together to end the pandemic. So once again, thanks so much for being with us this week. We will see you again soon.
Again, we've come to the conclusion of that briefing that the Texas Department of State Health Services held to talk about vaccine distribution for this upcoming week, how many doses have been administered this particular week. Also touching on the topic that has been on a lot of people's minds lately, that the federal government has recommended pausing the use of the Johnson & Johnson vaccine after 6 cases of women developing serious blood clots after getting that particular shot. So just to start back out at the outset of their comments and reiterate some of that really quickly, I will mention to you all that right now the Texas Department of State Health Services says that more than 5.2 million doses of the COVID-19 vaccine have been administered this week. That's 2 million more than this point last week. And at this time, more than 43% of eligible Texans have gotten at least 1 dose of that coveted shot. Also, when it comes to how the pause in the use of the Johnson & Johnson vaccine will affect things, the Department of State Health Services does not believe that that's going to affect the availability of shots at this time. They're even planning to get fewer Johnson & Johnson shipments this week and again next week due to manufacturer issues at some plants reported here in the U.S. What we are expecting from the state is that more than 700,000 first doses will arrive and be distributed next week to providers here in Texas. That is about on par with what we've been getting the past few weeks. The chief epidemiologist for the state of Texas also held an update about the Johnson & Johnson side effects that have been reported this week. Again, this is in 6 particular cases of women between the ages of 18 and 48, and they experienced severe symptoms 6 to 13 days after their vaccination. Those symptoms included severe headache, abdominal pain, leg pain, as well as shortness of breath. And they're asking that if anyone who got the Johnson & Johnson vaccine to monitor themselves for at least 3 weeks after getting that shot and report and see a doctor if they are experiencing any of those kinds of side effects. Right now, the Texas Department of State Health Services says that there have not been any reported cases of this blood clot issue here in the state. So again, they will continue to monitor that. We will have more information about today's briefing available on our website, that's kxan.com, and on the KXAN News app. Please download it if you've not done so. There's a new version for you all to check out, so we'd love for you to do that. Once again, I'm Will Dupree here in the KXAN Live Studio. Thank you all for watching. We'll see you back here another time. Please, everyone, stay healthy and safe, and take care out there.